going to be doing the assessment scenario, working on case study 2 here. I'll go ahead and get started by reading the case study. The patient is 28, and the history of present illness. This patient was in a single vehicle rollover accident 7 days ago. Injuries included left closed femur fracture, frontal/occipital brain contusion, injury, and you're helping PT evaluate this patient for therapy needs. Past medical history: major depressive disorder, diagnosed at 16, generalized anxiety disorder, diagnosed at 16, and tonsillectomy at age 18. There's a few medications listed there. Let me go ahead and kind of use the questions below here to kind of help me guide through this process. So what is my next action and why? I think initially, just kind of my basic go-to is I just want to identify this patient with 2 identifiers and see if they have any allergies. And I'm not sure if this patient is male or female. It doesn't say, but that would be a good thing to know just for treatment plan. And then provide the privacy and just make sure that the room is safe where we are. What would you assess and why? I would assess the patient's leg injury, the left femur, and I'm not exactly sure. It doesn't say whether or not there's a cast or if there's traction applied, but those are things that I would want to keep in mind. But I'd want to be checking the peripheral pulses, cap refill, the color, and the temperature of the leg, just to make sure that the healing process is going smoothly and that there's no complications like compartment syndrome. Those are things that you want to keep in mind. Also, another area assessment would be just a little bit of a quick neuro exam. What is this patient's baseline neurological status? Are they ANO times 4? What does that look like? Following the brain contusion. I think that's an important area to assess. Are they having any headaches? Anything like that? We're just worried about increased intracranial pressure. I think that's important to kind of consider. Also, just getting vital signs is always great, should do that. Heart rate, blood pressure, respiration, and temperature, and just getting those vitals and assessing the pain level, their tolerable level versus where they're at, if we can manage that better. Also, do they have an IV site? And if they don't, putting an IV in them, just to, you never know when you're going to need one, kind of a protocol type thing. And then also, do they have, if they do have a site, is it clean, dry, and intact? I think that's important to assess. What deficits would I expect to find? I think you would expect to find, pain, perhaps swelling in the fracture site, limited mobility, difficulty, doing those ADLs, or possibly just even moving their leg at this point. Also, deficits from the brain injury, possible impaired judgment. I think that could be something to look out for. Does mental illness affect the patient's treatment plan? I would say it does, because I think, well, one, you just have the medications and the side effects that come along with those that are always important to keep in mind. And then, because of the past medical history and that what he has, I think that those are important things to keep in mind, and just kind of knowing those signs and symptoms. And so I think it does affect the treatment plan, just a little bit differently than maybe someone who doesn't have those past histories. And what do you think got the patient to this point? I think obviously the car accident has kind of led to where he's at right now. Any labs? Labs, I would go just a CBC probably, and then any diagnostic tests. Possible X-ray of the leg, the left femur, I think would be important. Any other tests I was thinking maybe a CT scan of the brain, but I'm kind of guessing that they already did one because they know that it was a frontal occipital brain contusion. But I don't know, just something to consider if things are getting worse. Yeah, so I think would be appropriate. Are the medications appropriate? Would you add anything? As far as I can tell, the meds do look appropriate. And then, but would I add anything? I would add possibly um, maybe I was thinking of like a low molecular weight heparin or like a Lovenox, just because this patient's limited mobility, kind of been in the hospital for a while, and just make sure we prevent DVT prophylaxis. Also, maybe another thing I would add is an NSAID, um, non-steroidal anti-inflammatory, just because inflammation and just kind of help maybe manage some of the pain and inflammation associated with this condition. What I think, and so as far as just my overall plan, really just like having PT on board like we do. I was also thinking maybe have nutrition um, for nutritional needs, social work. Um, those are occupational therapy, perhaps. Um, I'm not sure if I said neurology, but neurology. Having those people on board and making sure we get this patient uh, the appropriate team to be helping him get back to optimal level of functioning that he can be. I think is really important. And going from there, just making sure we're doing the assessments, or watching the site or the injury. And so I think those are probably the most appropriate things we need to do. And the best possible outcome is just to discharge, um, as soon as possible and get him back to level of functioning that he was before, as close to as possible as we can. So, thank you.